So some of the cues, what I'm looking at, is turning of head. If the baby is, trying to turn the head back and forth and trying to look for the breast, so that's an infant cue that the baby is hungry. Bringing hands to the face and trying to put the fingers in, trying to suck it out, so that's one of the other cues. Making licking or smacking or sucking movements, like I said, sucking the hands, or even grabbing hold of the blanket or any clothing, that would be a very strong feeding cue. And if the crying is late, crying is usually a late sign of hunger. So when you kind of wait to that point where your baby is really, really crying, that makes the breastfeeding really more difficult, because the baby at that point is so hungry that it's not really able to latch on, and it's all kind of anxious about the whole breastfeeding session. So you want to make sure that you're looking at these cues, pick up the cues and start feeding your baby. And sometimes I also during the last session talked to the women saying, the babies do cry for certain reasons, so you got to really identify why they cry. First thing, where they're hungry for sure, like this. Second time they do cry, of course, if the diaper needs to be changed. And there's one other time when the babies really cry. It's probably because there's a little bit of, they cry colicky, and the first time parents will really panic because they say, oh my God, my baby's not breathing, or they really start panicking. So sometimes the babies do have a little bit of gas in the stomach, and their abdomen is so tender that the release makes it really painful, and they really cry and cry colicky. So at that point, you want to make sure that you do the burping and all that thing, but dietary-wise, I tell women, you want to make sure if there's any other kind of food, if that could be affecting your baby. It could be, I tell women to be careful about the cabbage family, like broccoli, cauliflower, Brussels sprouts, anything that is gas producing, even like cold milk, anything cold. So a lot of the cultures, I know they do the yin and yang, and the no cold foods during breastfeeding. So that's kind of a reason behind that. And I do respect the tradition coming in, and also bringing in stuff to increase the milk production, but you need to be respectful of that. So so I tell them, you want to make sure you look at your diet. If you had those kind of food, you might want to stop consuming that for maybe like a couple of days and see how your baby reacts. So you don't see that colicky issue, so maybe that was it. And you can reintroduce in maybe like a week or two to see how the baby is reacting. So once they grow, they kind of grow out of that. So in general, this is what I say is a lot of the raw vegetables are usually gassy, especially a lot of salads. And I know women try to do a lot of salad because they want to lose the weight and feel good. I tell them, if you can, try to do more of a cooked vegetable, steamed or grilled. Try to, not do a whole lot of raw vegetables. You still can get the fiber. That kind of helps with the colicky issue. But if you never had an issue with the baby being colicky, that's fine. But if you have consistent issues, that's probably where you can head to, kind of trying to avoid fresh vegetables and see, okay, does that help? So that's one of the things that I talk about. And also I talk about is caffeine passes through the breast milk. Coffee or tea or any kind of a caffeine coming from like even soft drinks or anything, no more than once or twice a day, because that kind of really goes into your breast milk. And definitely it's no smoking, and alcohol, definitely not. It's going through the breast milk to the baby. And spices, I do get a lot of question from my Asian patients. It's like, is spices okay? Spices are perfectly okay. And it's very individualistic. I mean, it really doesn't affect the baby, but if you think you got to do a lot of trial and error, I tell them you got to do a lot of trial and error with your diet and see how it goes. And no one thing could be same for every kind of population, so it could be different. And when it comes to herbs, and a lot of questions come from, can I take these herbs during breastfeeding so that it really could increase my breast milk production? Like I said again, you have patients coming from different cultures, and that has been coming for ages, the tradition. Especially I work with a lot of Asian Indian, and I bet a lot of you could be working with the same population. They come with a lot of goodies that comes with the mother or the mother-in-law, where they want them to consume, to increase breast milk production. So I would not actually say, no, you can't do that, because the likelihood of breastfeeding is more when you actually kind of tie that in and say it's okay to do this at any time when you see that interfering with your sugars, you might want to kind of taper off on that. So I normally like to have the mother-in-law or the mom or anybody come in for the last session, so I'm talking to them about all this, and so they're really clear about how much to do, what to limit. And also herbs, a lot of herbs, herbs have not gone through FDA clinical trials, so we don't know the safety or efficacy of the same, so I do tell them the same. And I say you could do that. I'm not saying not to do that, but again, you have to play it by how it looks. If it interferes with your sugars, you need to stop. If not, that's okay. So that's one of the things that you might want to really kind of focus on. So, these are some of the things you look at, and also encouraging. So if you were to tie in all this cultural beliefs, and that's one of the that increases the rate of breastfeeding. So we're almost coming towards the end of the session. This is one of the breastfeeding supporter that with the name kept anonymous said that my breasts have now done more for humanity in a few minutes than I've done in roughly my whole life. And it's so true. A little, even the first 3 months of breastfeeding, it does tons of good for the baby than you could think of. So this kind of, in summary, gives a more reason for you to, provide that valuable education to the patients to help them encourage breastfeeding throughout, for at least for the first 3 months, and for a year, that will be great. So just to summarize, in summary, so takeaway points would be you want to make sure that you definitely encourage breastfeeding. We talked about all the good stuff that in my slides, all of the good pointers you can give to your patients to say to make them encourage breastfeeding. In GDM, or it doesn't matter, GDM, type 1, type 2, breastfeeding is great across all kinds of diabetes during pregnancy. And talk about benefits of breastfeeding for the baby and for mom in terms of glucose control, because when you talk about the benefits of breastfeeding on glucose, it highly motivates the women. And also talking about bonding between the infant and the mom. And emphasis also place emphasis on importance of eating, meeting nutrition needs during lactation, and also talking about calories during weaning. And birth control, very, very important. Make sure you talk about birth control way before the mom delivers. If she needs any support after birth, feel free, encourage them to make an appointment so that you can talk to them about that. And depression screening, I would highly recommend that. A lot of the women end up into postpartum blues, and some of them are through antepartum going into postpartum. So talking about, picking up the signs and symptoms of depression, and at that point, making sure you do a screening and make appropriate referrals to the, to the provider or appropriate places, and discuss as a team for interventions to be done. Great, so that finishes my talk.